Days of deliberation, a group of experts decides healthcare workers will still be the priority sector for China's Sinovac vaccine. The Interagency Task Force this morning approved this recommendation of the National Immunization Technical Advisory Group, or NITAG, and Malacanang welcomes this development. Let's get more details from our correspondent, Caroline Bonquin. Caroline, what is the rationale behind this?
PIA experts gave several reasons Coronavac may be given to healthcare workers whether or not they are taking care of COVID-19 patients. For one, they said that despite the varying efficacy rates, it is still proven safe and effective against the coronavirus. Even for healthcare workers, it's 100% effective against severe COVID, about 80% against moderate COVID, and 50% against mild symptoms.
If we had this vaccine last year, in NCR, we could have averted 42 health worker deaths, and prevented 3,300 cases.
Experts added it doesn't have any component that might cause severe allergic reactions like in other vaccines. Health Undersecretary Maria Rosario Vergere also clarified the FDA's provision on Coronavac use for healthcare workers attending to COVID patients was not due to any safety concern.
For the national government to consider that given the low reported efficacy in the specific recipient group, providing Sinovac vaccine to healthcare workers may not yield the most ideal results, hence may not be the most rational use of this very limited resource given the context of limited vaccine supply.
We heard many times in the forum earlier the different members of NITAG and the Technical Advisory Group saying it's better to have 50% protection than nothing, especially since we don't know when the next batch of vaccines will arrive. They want health workers to have a choice whether or not they want this vaccine. Back to you.
Yeah, Caroline, just to be clear, this is still not recommended for senior citizens, right?
That's right, Pia. The priority list will still be followed, but the senior citizens will be skipped. However, there are only 600,000 doses of this donated vaccines from Sinovac from China, and it won't be enough. It actually won't be enough for over 1 million healthcare workers. The first ones to receive this vaccine will be those who are working at COVID referral hospitals. Back to you.
And what if a healthcare worker declines, Caroline?
Well, Pia, they will still be part of the priority group for the next batch of vaccines of a different brand for another brand of vaccine. But Dr. Nina Carandang of NITAG is hoping that healthcare workers would actually welcome Sinovac. She adds that healthcare workers' reaction would actually impact the public's confidence in vaccines. Pia.
That this is the
Caroline
best.
Bonquin there reporting.